Hi guys. Today we're going to be talking about how to write a progress note. So in this lesson, we'll cover the types of progress notes you can write, what information actually goes into a progress note, and what you absolutely must know before you write one. So let's start by addressing what a progress note actually is. Nursing progress notes document our patient's medical status. We document any assessments, care, treatments that we performed on our shift, and the patient's progress and response to those actions. So the goal of the progress note is to actually write it a chronological narrative of the shift, including any issues that you may have come across. So for instance, you can write a note after you complete your initial assessment. It may look something like this. You date and time, and you say physical assessment completed. Vital signs within normal limits. A patient is alert and oriented, ×3. No complaints of pain at this time. And then you can sign it. If there's anything abnormal about your assessment, it will go here as well, along with any interventions that you may have had. Now, it's important to understand and remember that progress notes are actually very, very, very legal documents, and they can be used in court proceedings, they can be used for insurance reimbursement, and for quality assurance purposes. So the nursing process is something that will never go away for any of us. It really does shape the way we work with as nurses. Now, with that said, it's important to show you how it affects the way we write our progress notes as well. So our assessment is anything that we found in the physical assessment or in the patient interview. Okay. You'll want to include that information in your note, particularly for those findings that aren't really that normal. Now, your NANDA diagnoses are used as dependent on your facility policy, but you may want to use it to determine what your central focus is going to be for your patient. It'll help kind of shape your plan of care. Now, as I'm mentioning plan, this is where we're prioritizing our care, right? So, this is why I say you can use the NANDA diagnosis, because in the process of prioritizing, you should be setting your goals for the patient to achieve on the short term. And the short term is usually on your shift. Maybe you want them to achieve something before discharge, okay? Either or. Now, interventions are really the implement stage of the process. Now, again, these are the treatments that we provide. And any other care during that shift as well, okay? And then we have the evaluation stage. Now, this is where we're looking for the response to the interventions and making changes to the plan as needed. Why did I bring this up? We all know ADPI at this point, but what you may not know is that you can always refer back to it if you get stuck on what to write in your notes. So what do we put into a progress note? Okay, remember, we're creating a narrative description of what happened with the patient during the shift. So we want to include the patient's condition, any abnormal lab values, any diagnostic results, any tests that the patient had completed or ordered should also be included, even if we don't have the results back. Medications and treatments, as well as the patient's response to them, are very important to include. This includes patient concerns, complaints, any other issues, as well as the care or any teaching we have provided during the course of the shift. What we want to know is if they tolerated the treatment, or if a change has been made or is warranted. Were there any new med orders made? We also talk about any follow-up care or consults that may be required. When you hear it in a list like this, it sounds like a lot, but you think about what you're expected to do on your shift as a nurse, okay? The most important takeaway here is that you want to document the things that happen, because if you don't, it didn't happen. So there's a lot of different ways to write a progress note. However, we'll discuss the ones that you really do see the most frequently. Now, these are going to be the SOAP note, the PI note, and the DAR note. Now, let's explore these individually. So your SOAP notes are the most popular progress note for nurses, and they fall into a category of problem-oriented notes, which means that they're focused on the reason for seeing the patient. It generally lays out exactly what we need to include. Okay, so subjective information is what comes from the patient. And we take this information in the history and physical most often, and it includes not only why they're here with us, but also details the symptoms that they're having. Objective information is what we observe, usually from the physical assessment that we perform. Now, bear in mind that there can be times where the S and the O don't necessarily add up, but make note of it all anyway, okay? Then we have the assessment and the plan. Again, we take this from the nursing process. Find the problem, make a plan to fix it. All right. So let's say we have a patient who just had abdominal surgery 2 days ago. The SOAP note may look something like this. Patient reports pain and itching around the surgical site. The patient states the pain is a 4 out of 10 and throbbing. Okay. That's your subjective information. Your objective information is what you see. Patient is alert and oriented ×3, calm and cooperative. Vital signs within normal limits. No edema to extremities, lungs clear, maybe out of bed to chair with assistance. And remember, we're talking about a surgical patient, right? Positive bowel sounds in all 4 quadrants, redness and swelling around the surgical site, tenderness noted in lower and left upper quadrant, okay? No draining or bleeding present, okay? So this is all that we're seeing for ourselves in our assessment. The dressing is clean, dry, and intact. Pain medication given per order for mild to moderate pain. Call light was in reach. Always make sure that you tell what you did or what you saw at the end. So your call light should always be in reach. If you want to make sure that you put that in your objective, that you always want to make sure that it's somewhere in the note. Okay. And then the assessment is going to look like this. Now, this is what we do after we've treated the patient. After our assessment is done and we've completed our intervention, this is what we're going to look at. Patient's pain level decreased to 2 to 10 after medication. Okay. Patient has some shortness of breath after ambulation to chair, complains of mild fatigue. Again, this is what we did. We're addressing what we see and what's happened after our intervention. Okay. Your plan was your P, okay? This may be something like, we'll continue to assist with activity as tolerated, okay? Continue pain medications, skin care, dressing changes as ordered, and your plan to assess the surgical site throughout the shift and report any issues to any other issues to the physician. You want to make sure that you add that in there as well, okay? Pie notes, okay? These are another problem-oriented note, but these kind of rely more on the use of the nursing diagnosis to identify and document the problem, discuss the care or treatment that's going to be provided, and then whether or not the intervention actually worked. So pie notes are a little bit more clear-cut and to the point, but they don't allow for as much detail as SOAP notes do. Now, let's use the same patient that we just discussed, for example, okay? So the pie note may look like this. Your problem is your P, acute pain related to surgery. Okay. Now, depending on where you are, you may have to do an as evidenced by. So in this particular case, we'll say as evidenced by reports of pain 4 out of 10. Okay. Your I is your intervention, administered pain medication, right? Your pain meds were given as ordered for mild to moderate pain. Assistance provided for out of bed activity, call light, placed in reach. Okay. Very simple. We said the same thing in the SOAP note, just a lot more detailed. Okay. And then your evaluation is going to be that the pain decreased to 2 out of 10 after your pain medications were given, right? Patient uses call light when in need of assistance. Remember, we put the call light there. We said the same thing again that we did in the SOAP note, but we're just focused on the central issue. Okay. In this case, it's the patient's pain. We're talking about the acute pain as the problem. Okay. If there are any other issues, you can write a separate note on those as well. So DAR notes are in a different category than SOAP and PI notes. DAR notes are actually what we call focus notes. And these highlight a specific problem, condition changes, concerns, or events. Now, when you think of it that way, it's really easy to determine what each piece is for, but I'll explain it anyway, okay? Our data comes from the assessment findings. So this is likely both subjective and objective information if you think really in terms of the SOAP note, okay? Action and response are exactly that. What did we do to address the problem we've identified, and did it work, okay? So let's revisit our post-op patient again, all right? So the DAR note may look a little something like this. The data is patient is 2 days post-op, right? We have that information. This is the information I gave you in the actual example. Post-op abdominal surgery, right? Patient complains of pain 4 out of 10 around the surgical site. Some redness, swelling, tenderness noted at the site, okay? Our action, again, we're looking at pain. We're going to give. Now we're going to name what we're doing. Tylenol, 325 milligrams, 2 tabs, PO, administered as ordered for mild to moderate pain, okay? And then our response is very simple. Patient reports pain decreased to 2 out of 10 after medication. So again, all of these notes said the exact same thing. It's just very different focal points, okay? So this is really, generally speaking, I wrote it in shorthand just for time's sake, but you guys hopefully will get the gist. So we've arrived at the rules for writing progress notes. Now, remember we said earlier that progress notes are a legal document, okay? If you're ever called to testify in court, your notes can actually be used as evidence. So you want to make sure that you're consistent, concise, and timely with your notes, okay? What this means is never write notes in advance, okay? Anything can happen. And more importantly, if you're writing ahead of time, do you really have true knowledge of the situation? Probably not, okay? We want to make sure that everything is concise, timely. You write it after it's done, okay? Now again, I use shorthand, obviously, for time constraints, but we love to use shorthand in the medical field. And it's okay to do this, but just be mindful of the shorthand that you're using. Make sure that the abbreviations that you use are standard and approved before doing so. Make sure that what you're using is familiar to everyone that's reading it. No one wants to have to go back to track you down and try to clarify what you meant. Okay. Include any and all communication that you've had regarding your patient, and ensure that you're using quotations so that it's clear that you're writing a statement that was made by the person that you're referring to. Okay. This includes family members, visitors, medical personnel, whoever. Okay. This is important because, again, once it's written down, it cannot be denied or changed. So you want to make sure that you're accurately giving the information. Okay. Above all else, okay, you guys, you've earned your credentials. You have worked hard for them. Make sure that you're using them when you sign off on your notes. It's a standard, I promise, that you will get used to. So a final note, for those who still create handwritten notes, okay, I know there's some of you out there, far and few between, but just for you, okay, make sure that you're writing legibly in black ink, okay? This is a legal requirement, I've always been told. I really don't know, but it doesn't look right any other way, so make sure that it's in black ink, okay? Also, correcting errors is a really big thing for legal reasons. We all make mistakes, okay? And it's okay to do that as long as you find it and you correct it. So if you're writing a medication, say, but you put the wrong dose or the wrong frequency, okay? When you make this error, whiteout is not permitted. You should not own whiteout. What you should be doing is putting a line through it, correct the error with, let's say, QD, okay? Correct the error with your initial, date, and time, okay? That's all you have to do. Very clear cut, very simple. That's what you do with your errors, okay? So let's talk some key points. Remember, progress notes are legal documents. I can't stress this enough, okay? They can be used in court. They can be used for insurance, to pay your facility. They can be used for QA. They can be used for whatever, okay? Be mindful of what you write. If you ever get stuck on what to include in a progress note, that's okay too. It happens, but you can always go back home to the nursing process, okay? Also, a goal in writing progress notes is to stay objective, okay? This is not the place to air your grievances, and it should stay judgment-free all times, okay? So we don't put any judgment in, only factual information. Only the facts, guys. Now, most importantly, always remember, if it's not written, it did not happen, okay? Make sure you hit everything that you want the reader to know, and that everything that you write is accurate and can be used against you or with you in court.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.